What does dementia and diabetes have in common? Well, if you've experienced short-term memory loss or confusion like my dad recently, it might be related to your diabetes or specifically your high blood glucose level or sugar level. But these two symptoms are also common in dementia as well. And that's because both conditions affect how we think or the cognition of our brain. Data shows that people with diabetes, like my dad, are at higher risk for developing dementia. Now, with my dad, he has diabetes for a very long time. And recently, his confusion and short-term memory loss has gotten worse. This is another reason not to develop diabetes, because you are at higher risk of developing dementia. I know it's too late for my dad. He has diabetes too. And that's the most common form of diabetes compared to diabetes type 1. In this video, we will cover what prompted my dad's 4-night hospital stay. Hint, it is related to his diabetes and not his dementia. And that 4-night admission incurred about $140,000 in Medicare bills. Now, I go over that medical bill in detail in a different video. So, due to the confusion, I took my dad to the emergency room so he can receive the diagnostics test that was ordered by his primary care and his cardiologist. Because of his confusion, specifically he had wandered off, I knew it was important for him to see his primary care. So these diagnostic tests were for his dementia-like symptoms, the confusion and the short-term memory loss that happened several months ago. So the cardiologist also wanted to order a 2D echo of my dad's heart. And that's because the primary care picked up a newly sound, a heart murmur of his heart. While in the emergency room, though, we found out that his blood glucose level was well over 300 milligrams per deciliter. A value of 300 or higher requires immediate attention. High glucose or high blood glucose is called hyperglycemia. Here are some other common symptoms of hyperglycemia. Dr. Komorowski, a board-certified endocrinologist, doctors who specialize in diabetes at Houston, Texas, said, end quote, "If glucose levels are very high, over 300 milligrams per deciliter, individuals can become confused, lethargic, and experience shortness of breath." That's really key. Those three symptoms are what my dad was experiencing for the last several months. Now, to me, that sounds a little bit different than high glucose level. So it's more important nowadays, if you have diabetes, really understanding what your regular glucose levels are. So as a result of this, my dad stayed in the hospital for 4 nights to bring his glucose down to a more manageable level. And remind you that he really went into the emergency room to get his diagnostics test done sooner than later, because otherwise he might be waiting several months to get this done outpatient. I'm curious, do you guys have diabetes yourself? And do you know your last blood glucose? But you may be also wondering, how did we know that he had these high values for almost a year or possibly longer? Well, another key value we need to check is your hemoglobin A1C, A1C value for short. My dad's A1C value averaged around 10% in the 3 previous readings that his doctor's office ran. An A1C value of 5.7 or less is considered normal. And you see, A1C provides a historical view of your glucose level back to about 2 to 3 months. So in my dad's case, these percentages were close to 10%, which indicates that his high blood glucose levels were probably throughout at least a year. So one of the things that we found out, because I did some digging and I was alarmed that this was not seen earlier by his primary care and communicated to my dad. Having high glucose levels that high for long periods, it's dangerous. You could develop really serious conditions. And my dad right now is showing some of those serious conditions. I mean, if you have these high glucose levels for a long time, it really impedes the regular flow of your blood throughout your body. And that results in not enough blood circulating in some of your extremities. So some of the end stage diabetes patient will have some of the lower limbs amputated. And my dad is showing symptoms like tingling in his legs. And that's usually a symptom that is associated with not enough circulation going through his lower extremities. So that's something to think of about why not to have these high glucose levels in a chronic manner, something to be addressed sooner than later. We weren't sure why these values were not communicated to my dad. So I did some digging. I found out that my dad was not seen by a medical doctor, but by a physician assistant during those previous visits. And according to the United States Department of Labor's website, physician assistants examine and diagnose and treat patients under the supervision of a physician. And you might have been seen by a physician assistant rather than a medical doctor. And do you feel that this issue would have been caught earlier than later had my dad been assessed by a medical doctor? It's really hard to tell. And was this a situation where the physician assistant notified the doctor but got lost in translation? Because everyone these days, and in particular our healthcare system, we're already burdened. So that's why it's more important for you, if you have diabetes, to stay on top of it. And what's kind of funny and interesting is that my dad and my mom, but particularly my mom, she's also seen by a physician assistant. And when she converses with me, she refers the physician assistant as her doctor. We immigrated from Korea, so they're not too savvy in terms of how the medical system is run. Heck, I think most of us don't know how our healthcare system is run. But in their case, they really don't know. So a lot of times I have to let them know that there are differences in the healthcare profession, and that it's really important when on assessment is to be seen by a medical doctor. And if you're seen by your physician assistant or even a nurse practitioner, make sure that whatever is found is communicated to the doctor in a timely manner. I think this issue would have been caught earlier than later if an ND had assessed my dad. Well, I'm not sure. Was this a situation where a physician assistant notified the doctor of the high glucose value, but the communication was just dropped? Really is not clear in reviewing my dad's medical chart. And yes, after this scary episode, I now have access to both of my parents' medical chart. Parents did not grow up with technology. They're not comfortable navigating through these health charts, and it made sense that I took over that role. These patient charts are not that intuitive. Remember, we live in an imperfect human systems world. These health charts are cumbersome to navigate through. And as with other health systems, patient health charts are not designed to be used by patients. Heck, as a nurse even, going through the medical charts, it takes a little bit of time to become an expert in it. And possibly that's maybe why the A1C value were not communicated or shared with my dad. Going back to why our health system utilizes other health care providers like physician assistants is because there's not enough physicians for the number of potential patients. Physician shortage is still a problem for a number of reasons. One reason is the growing aging population. Well, naturally, that includes physicians. So, having not caught the A1C level earlier, what's happening to my dad could happen to you. My dad is now having to inject insulin every day. He needs to prick his finger twice a day, first thing in the morning and one after dinner. And he uses a sliding scale, which means the dose of insulin you give is based on how high your glucose level is. And so he gives his insulin shots every day after dinner. My mom is there to help him, but this situation also added more burden to my mom. So we're fortunate that my dad's diabetes is now more under control, but it's not perfect. His blood glucose readings continue to be in the high 100s to 200s. In my last visit, I see that he is more forgetful, and I see that he becomes more agitated. And I think it has to do with having him deal with this diabetes and now having an added medication that he has to check. If you have diabetes or know someone who has diabetes, don't necessarily rely only on your doctors to inform you of your high glucose or your A1C level. So if you had those blood work done recently, please check those levels. And I firmly believe prevention is key. However, no matter how you try, you might end up developing diabetes. I have what's considered prediabetes. And if you do, the best thing you can do for yourself is to be an active agent for your health and check your glucose level regularly. And at the end, uncontrolled diabetes can lead to these following serious and lasting conditions. Again, thank you for watching my channel. Please don't forget to subscribe. And until next time, everyone, please stay healthy and well.